Okay, so now this is the implant that I just did for Canada. She's left. She's given post-op instructions, ice on her face for the next week. I'm going to just give her Advils, 200 milligrams or 400 milligrams, 3 times a day if she wants. Soft foods for the next couple days, and everything on the right side, no eating on the right side. And we also give her a rinse called Paradex, which is a prescription that's also an oral antimicrobial and helps promote the healing. But no antibiotics, not in this case. I don't see any need for antibiotics. Some other guys give antibiotics, I don't. Because these rarely get infections. Okay, so let's look at the implant here. And we can see it's pretty much in the center of the bone. I make a little joke called Made in Canada. What does that mean? That it was actually done in Canada, but even more than that is that there wasn't a man-made splint to guide me to put the implant in the center. I did that on my own, just with the manipulation of my eyes and my hands and my dexterity to put that implant in the middle. So that takes quite a bit of skill, I think. It's not so easy. So I've done once. I never have used a splint for singles. I always try to do it by hand-eye coordination. And this one I'm very pleased with. We're talking about using an accessory splint. I don't use them. Why? Because first of all, they cost a lot of money, and I just like to just do it by hand. If we had a splint, a surgical stent, I should say, it would guide the drill right in the center here, so to speak. But there's a lot of work to do, something like that, so it just makes things more complex and more expensive for the patient, so I don't do it. So what's nice about this implant is, first of all, it's a 13 millimeter. So from the tip of it to the top of it is 13 millimeters. Here's the healing cap on that we showed here, right down the center, and there's no gap between the top of the implant and the base of the healing screw. The gum is around here, if we remember that from the video from before. And what else do we have? So we have nice bone thickness between here, right? And when I did my first osteotomy, my first entry point, I went in 16 millimeters. So I basically went to the base of the sinus. That's what I got in. Then I went in with one more drill, and that was it. So it really